Peripheral arterial disease is a disease that affects millions of people every year, primarily in those individuals that have diabetes and other folks that have high risk factors, including risk factors for heart disease and many other types of disorders that affect the vascular system. Specifically in podiatry, we see lots of people every day that come in that have symptoms that are consistent with PAD, and those can be symptoms like cramping, pain in the legs, pain with any type of exertion, non-healing wounds, and many other examples. PAD also kills millions of people every year and results in of course, a high cost in hospital care and in lower limb amputation, and of course, the correlation between PAD and cardiovascular risks is extremely high. In our practice, assessing PAD is very important, and we use probably the most advanced system available for us to assess PAD, and that is the BioMedix PADnet system. In our office, we use this technology to assess the patient's circulation in their lower limbs, and it gives us multiple pieces of information to be able to make sure that patient gets in the right direction. The PAD testing with BioMedix is performed using an online system that allows us to use a collaborative care model to be able to communicate with our vascular surgeons and general practitioners and family physicians to keep that circle of communication ongoing, so we can make sure that once we do the test, that patient gets directly to where they need to go right away. So the testing is fairly simple, it's non-painful, and it's a test that essentially looks at particular types of values that are called ankle brachial index values, and they also assess PVRs. Those are called pulse volume recordings. And what we do when we look at those along with the vascular specialist is we try to assess your risk scale and where you're at along that risk scale. And then we make sure we get you the right treatment for that condition. It's obviously important that you be assessed for this early. The earlier you catch this disease, the earlier you can intervene and hopefully reduce the risk of amputation and, of course, of morbidity and hospitalization.